GERD's worst nightmare? According to the internet, ginger. But before you start chewing on raw ginger like a raccoon at a picnic, let's talk facts. And then there's apple cider vinegar, the so-called miracle cure. Because science suggests it's about as helpful as a screen door on a submarine. And yes, I've tried both. Spoiler, one made my reflux worse, and the other just got me very wet. Today we're myth-busting the wildest GERD remedies on the internet using real studies. Zero TikTok nonsense, and a dash of common sense. Quick but important note. Before we start, this video is for educational purposes only and not medical advice. Always talk to your healthcare provider before starting or stopping any treatment. Alright, real talk. GERD turns life into a never-ending game of why does my chest feel like Mount Vesuvius? At one point, I was so desperate, I tried aloe vera juice, so much aloe vera juice, that I swear my sweat started smelling like a spa. And don't even get me started on the pillow situation. I tried sleeping propped up like the princess and the pea just to keep the acid down. Spoiler, I woke up with a crick in my neck and heartburn anyway. You're not alone. GERD affects 1.8 billion people worldwide, and that's more common than pineapple on pizza and just as controversial. But here's the key. You don't need to fall for every internet hack that pops up on your feed. Today we're bursting the most common GERD myths on the internet, and stick around because one of the most popular natural fixes actually make reflux worse, and most people don't realize why. So what actually works? What's pure snake oil? And how do you use these remedies safely without accidentally making things worse? We're talking clinical trials, meta-analyses, and zero sugarcoating. Let's start myth busting. So myth number 1, apple cider vinegar. The apple cider vinegar will cure your GERD crowd is louder than my neighbor's blender at 6 in the morning. But here's the thing. A 2023 randomized controlled trial published in Gut suggested that apple cider vinegar was associated with increased reflux symptoms in about 70% of participants. That's not just a fail, that's a call your dentist level fail. And when someone says, but it's natural, so is poison ivy, Karen. Pouring vinegar on a burn? Yeah, that's basically what this feels like. Save your taste buds and your esophagus. Myth number 2, probiotics as a cure-all. Probiotics are kind of the Marvel sidekick of gut health. They're great for overall digestion, but a 2024 meta-analysis found they are not a standalone treatment for GERD. They may help a little by balancing gut bacteria, but don't expect them to save the day. If you're eating pizza at midnight and sleeping flat on your back, helpful? Sometimes. Magic bullet? Not even close. Myth number 3, baking soda shots. Here's a pro tip. Baking soda for reflux can spike your blood pressure faster than my buddy's pre-workout. A 2025 study found that a majority of participants experienced worsened bloating after trying it. Unless you're prepping for a Mentos and Coke experiment, skip this one. Myth number 4, sleep upright, but wrong. Some people swear by sleeping upright, but if you're only lifting your head and not your whole torso, all you're really doing is signing up for neck pain. Studies suggest elevating the head of your bed by 6 to 8 inches may help. Stacking pillows? That's just chiropractor bait. So, let's have a quick pause. If this has helped you so far, hit like and subscribe. It really helps the channel reach more people who are dealing with this stuff. Alright, enough myth busting. Let's talk about what actually works. And no, it's not yoga, unless your yoga pose is don't eat spicy tacos at 10 p.m. So remedy number 1, ginger. Your grandma was half right about ginger. Some small studies suggest that ginger can help the stomach empty a bit faster and may ease upper GI symptoms like bloating and indigestion. And it is one of the best studied natural options for nausea. For classic acid reflux or GERD, the evidence is still limited. So think of ginger as a possible helper for mild symptoms, not a proven treatment or replacement for a prescribed medication. As always, talk to your healthcare provider before adding any supplement and avoid high doses because too much ginger can irritate your stomach. Remedy number 2, DGL licorice, Let's get clear on something. This is not candy licorice. DGL stands for deglycerinated, which is a form of licorice with most of the blood-raising compound glycyrrhizin removed. Regular licorice can raise blood pressure if overused. Small clinical trials with licorice extracts have shown improvements in heartburn and regurgitation scores compared to placebo. This means it is not just folk medicine, but the research is still limited and not as strong as what we have for standard reflux drugs. If you try DGL, think of it as a possible add-on for extra protection, not a replacement for prescribed medications, and check with your doctor, especially if you have high blood pressure or heart or kidney conditions. Remedy number 3, aloe vera. Aloe is not just for sunburns. In a clinical trial, aloe vera syrup taken daily for 4 weeks was associated with reductions in heartburn, regurgitation, and nausea in people with GERD, with effectiveness comparable to standard acid-suppressing medications, like proton pump inhibitors and H2 blockers. Just do not squeeze the plant straight into your mouth. The latex portion of raw aloe can cause diarrhea and cramping, which is a whole new problem you don't want. Remedy number 4, slippery elm and marshmallow root. Slippery elm and marshmallow root are classic demulcents, meaning they form a gel that can coat irritated tissue in the throat and esophagus. Laboratory data and traditional use suggest this layer may act like a soft shield against acid, but GERD-specific human studies are very limited and usually involve multi-herbal formulas, not these herbs alone. These are best viewed in traditionally soothing helpers, not firmly proven heartburn treatments. Remedy number 5, melatonin may do more than help you sleep. Small randomized trials suggest it can improve heartburn scores and in some cases perform similarly to standard acid-suppressing medications for symptom relief. Melatonin produced in the gut may reduce acid secretion and support the lower esophageal sphincter, making it particularly interesting for nighttime reflux. But at this time, it is best viewed as a promising add-on rather than a first-line therapy. Remedy number 6, alginate-based remedies. Alginate-based remedies act like a raft for reflux. They react with stomach acid to form a floating barrier on top of stomach contents, which helps reduce acid reaching the esophagus. In people with non-erosive reflux, a 4-week randomized trial showed a sodium alginate suspension was as effective as a standard acid-suppressing therapy for symptom relief, with a rapid onset and strong safety profile, making it a solid option for on-demand heartburn control. Remedy number 7, traditional Chinese herbal formulas. Some traditional Chinese herbal formulas for reflux have been evaluated in clinical studies. Meta-analyses suggest that when certain formulas are added to standard therapies like PPIs, more patients report symptom improvement and sometimes fewer flare-ups than with conventional treatment alone. However, many of these studies are small and lower quality, and complex herbal mixtures can interact with medications. These should be treated as discussion points with a qualified healthcare provider, not to do-it-yourself replacements for prescribed GERD treatment. Remedy number 8, probiotics revisited. Probiotics are not the main hero, but they still help. A 2020 review of GERD studies found that most trials showed some improvement in symptoms such as reflux, heartburn, and belching, although the strains and doses were varied widely. Larger analyses in digestive disorders also show modest benefits for bloating and upper GI symptoms, especially in people using PPIs long term. Think of probiotics as a symptom tune-up rather than a replacement of acid-blocking medication. All right, your turn. Drop the weirdest GERD remedy you tried in the comments. Pickles, standing on your head, something your aunt swears by. And if something actually helps you, share it, because sometimes the best tips come from real people, not just from research papers. Here's the reality. Natural remedies may help mild GERD, but moderate to severe GERD often still requires medication. Please do not stop a prescription just because you saw a cool YouTube video. Talk to your doctor first. Natural does not mean better. It means sometimes helpful, sometimes hype. If your reflux could power a rocket, do not ghost your meds. GERD is a pain, literally and figuratively. But when you follow the signs, you actually have options. Natural remedies can help if you choose wisely, use them safely, and keep your doctor in the loop. Drop your worst GERD myth below. Mine? Chug milk. Spoiler, it just creates more acid. Like, subscribe, and stick around for more myth-busting health signs. Stay hungry, stay curious, ask the right questions. Wellness Watchdog